more than 30 countries. Thousands of people helped and healed. International Medical Outreach, a collaboration between Carolina's healthcare system and the Heinemann Foundation, has helped transform the delivery of healthcare around the globe. International Medical Outreach partners with medical facilities and creates networks of support in underserved communities. Creating sustainable healthcare, IMO offers free training to international caregivers and donates equipment and supplies to hospitals and clinics in need, equipping communities with the tools and skills they need to care for themselves.
Our role should be to put them on their own feet and give them a self-independence. The need is there. Matter of fact, the need finds you, and the need finds you very fast.
Started by Dr. Francis Robacek, a cardiothoracic surgeon who had the will and saw the need, IMO made its first global marks with cardiac research. A Chinese proverb says, "Give a man a fish, you feed him for a day. Teach a man to fish, and you feed him for a lifetime." This is the engine that drives, that propels the International Medical Outreach Program. The impact of international medical outreach has been profound from Western and Central Europe to Africa, the Middle East, and Central America. IMO offers training, donations, and healing to communities around the world. One of the many rewarding projects was carried out in Nicaragua, where supplies and surgical instruments were donated to the country's only pediatric hospital. Then, a catheterization laboratory donation brought Nicaragua's National Center of Cardiology up to new millennium standards, making access to cardiac care a reality for many residents.
A mí me dio un infarto y gracias a Dios y a los donantes, ¿verdad?
In Guatemala, IMO's footprint is significant. The program helped build UNICAR, the country's first cardiac center, and Central America's only comprehensive heart institute.
After I met Dr. Francis Robacek in 1972, he realized that Guatemala had no heart surgery. And then he says, we can train the doctors and then you develop a unit.
It's a privilege. I've thought of that many times. I had the privilege to receive this kind of treatment and to receive it here because this is not open for anybody.
Oscar Flores, Guatemala's first echocardiography technician, trained in Charlotte with a team from Carolina's healthcare system, fulfilling a lifelong dream of caring for those in need.
I wanted to be a doctor, but in my family, we didn't have the money to pay for university. If me being here means that one person can have a better life, then I'm in the right place.
Blood flow that is moving towards the
A virtual communication portal launched in 2012 now connects doctors from Carolina's healthcare system's Sanger Heart and Vascular Institute with cardiologists in Guatemala 24 hours a day, 7 days a week. New echocardiography laboratories across Guatemala are making cardiac care accessible for thousands of patients in urban and rural areas like Cuilapa, so patients can get the care they need when miles and minutes matter. Computers, the tools to teach the next generation of doctors, surgeons, and scholars, are also being donated by IMO through Guatemala's Technology to Educate project.
It's a wonderful program. If you think about a child growing up and not having access to a computer, this just opens up horizons for people that are unbelievable. And it gives these kids access to technology, and that's where the world is.
In countries like Honduras, International Medical Outreach has helped equip pediatric and adult intensive care units, a burn institute for children, and an indigent outpatient clinic in the rural city of Copan Ruinas. In Costa Rica, IMO donated equipment and medical training that helped make possible the country's first successful heart transplant. In Mexico, equipment, hearing aids, books, and other supplies support a regional school for low-income deaf children. In Haiti, in partnership with other organizations, a major health clinic and infirmary will be built. Past the shores of Central America and the Caribbean, healthcare services are now being delivered to rural villages in Kenya. Organized emergency medicine has become a reality in Tanzania, and doctors and nurses from Liberia are being trained in the procedures and administration of chemotherapy treatments at Carolina's Healthcare System's Levine Cancer Institute. Syria, the Republic of Congo, insect plague eradication in Uganda, hospital beds in Ghana, and the journey continues, making life-changing impact. In 2011, IMO began a journey with the people of Belize, bringing the first fully equipped cardiac catheterization lab and diagnostic imaging capabilities to the country. And in 2012, a Belizean surgical team, assisted by a cardiology team from Carolina's Healthcare System, performed Belize's first open-heart surgery.
Thank you, Francis.
Well done,
You made history one day.
For Amir Alfaro, this first was a second chance at life.
I don't know how to describe it, but it means a lot for me because I'm so happy, you know, and I will be like free.
Inspiration is an important thing, and hope, two very important things for a young country, developing country. So for us to have such a program and a successful program, I'm hoping it inspires the young ones, obviously, to think and dream large.
We're deeply grateful for all the support that we've received, but we're not finished yet, and we have a lot more work to do.
Saving lives, transforming healthcare, facilitating medical education and training, inspiring new generations. Carolina's Healthcare System's International Medical Outreach Program and the Heinemann Foundation of Charlotte have made it their mission to serve around the world and wherever they are needed.